So we only have 2 more sections of the CPT book to go through. So our next to last one is pathology and lab. So the first section in your book talks about specimen collection. Because if, let's say, a physician's office is the one that actually collects the specimen and then they send it to, say, an outside lab to do the actual test, the physician's office can get paid a little bit for the purpose of collecting the specimen, and then the lab gets paid separately to actually perform the test. Okay? So here's a little bit about specimen collection. Okay? There's just about 3 high points I want to hit for this particular chapter. This is one of them. So in lab, you have two kinds of tests. You have quantitative and qualitative. Qualitative just means, is a substance present? And then quantitative means how much. Okay, so some of the drug testing might be like, is there a drug present in the blood? That would be a qualitative study. If you're doing a study of the blood, let's say a person is on a specific medication, you need to see what the level is, because the level of the drug, in order to be effective, has to be between X and Y. You would do a quantitative study to see exactly how much is in there, because that would tell you if the patient is taking their medication correctly. Okay? So qualitative just means, is it there? Quantitative means how much. Okay? So here's some examples. A dipstick, that's when you go to the physician and you have to give them a urine sample, and they literally just take that dipstick out of a little jar and dip it down in there. And I'll post a picture of that. So here's an example of a dipstick that you would just take the strip out, dip it in the urine, and then compare the results based on each color for each thing. Okay, so kind of quick and easy. Remember, we always do least invasive first. So this would be a quick way to tell us if further testing is needed. So also in the sections where you're going to find your flu test, your rapid, streps, all that kind of thing. Okay, so the second high point I need to make sure that you understand in this section is panels. So a panel, a lab panel, means that they have developed a code, a CPT code, for several, so a group of tests that are commonly formed together. Okay, performed together. So here's an example. An electrolyte panel. Okay, so typically, if a physician needs to see results on electrolytes, they're going to commonly ask for each of these: a carbon dioxide, a chloride, potassium, and sodium. So what they've done is they've put them together, called them an electrolyte panel. Okay, this is what you need to know as a coder. You cannot bill. Let me say that again. You cannot bill a panel code unless every single one of these tests is completed. Okay? So for example, let's say a physician orders the chloride, potassium, and sodium. You cannot bill the panel. And you cannot ever bill a panel with a modifier of the reduced services code. Okay? If the physician only orders 3 of the 4, then you have to list each of the 3 separately. So that's why they have the codes for each one to make it easier on you. Okay? So instead of an 80051, you're going to list an 82435, an 84132, and an 84295. Okay? So everything must be done, or you have to list them separately. So that's the big, okay? So that's the big part about panels, okay? All right. So here's common things about chemistry tests. Do a lot of chemistry, laboratory tests. Okay, we won't get too deep into the molecular diagnostics and the genetic testing. Immunology, how the body's immune system works. There might be some microbiology. Cytology, the most common cytology test is a pap smear. Okay. So those will be under here. This is the third high point that I want to make sure you know. So in surgical pathology, okay, surgical pathology means that a patient has had surgery and some tissue has been removed from the person, okay, and they are sending it to the lab for examination, okay. So now remember, when you're coding, you have to remember who you're coding for, what provider. So you are going to use these codes when you are coding for the pathologist that is reviewing the specimen. Okay. So you're going to see the first code, you're going to see the 88300, which says gross examination only. What that means is let's say they take out a gallbladder. Okay. They send the gallbladder to pathology. The gross examination means the doctor looked at it and it looks, is it the size, the shape, the texture, the color, all that kind of stuff that a gallbladder intact should look like. That's what a gross examination means. Okay. So stop here and go over to page, go to your gross pathology section, which starts on page 670. Okay, so you'll see after the 88300, which is the gross examination only, then you're going to see an 88302. And you'll notice that says a level 2, gross and microscopic. Okay, so let's look at an appendix. Okay, so under there's a list of organs, right? There's an appendix, a fallopian tube, a finger, a toe, a foreskin, etc. Okay? So what that means is let's use fallopian tube for sterilization. So let's say a female, let's say they cut, the fallopian tube, tie it off, etc. Okay, for the purpose of sterilizing. Okay, so they send the piece of the fallopian tube to pathology, just to make sure that there's nothing going on that they don't know about. Okay, so with the 88302, it means the pathologist looked at the tissue, made sure it was the size, shape, etc. that a fallopian tube should look like, or the piece of the fallopian tube, okay? But then the pathologist also took slices of the tissue and looked at it under a microscope to make sure there weren't any kind of cancerous cells or anything abnormal on the cellular level, okay? So you have to make sure that they're not just doing a gross examination, but they're also doing the microscopic. Most of the times they're going to do that just to make sure there's nothing cancerous, under a microscope, so they can make sure there's nothing bad. Okay? So when you look at pages 670, 671, and 672, so if you are going to send a specimen off to a pathologist, you essentially have, first of all, you have to know, is it gross and microscopic? If so, then you start at an 88302, and you just have to find the tissue or the body part under the list. Okay, now you're going to see sometimes that a body part's going to appear more than different levels. Okay, so if you see under an 88302, we've got a fallopian tube for the purpose of sterilization. If you look under the 88305, you've got a fallopian tube for the purpose of a biopsy or for the purpose of an ectopic pregnancy. Okay? So you can't stop at just the first one. You got to make sure that what piece of tissue they took out or what organ they took out and the reason they took it out. Okay? Because if you also look over there on the second column on page 671, it says like stomach biopsy, tongue biopsy, tonsil biopsy. Okay? But if they're actually removing something for more serious reasons, it might be a higher level. Okay? So look at like 88309. So you've got a breast mastectomy with the regional lymph nodes. But you've also got, over at 88307, a breast mastectomy that's a partial or simple. Okay, so you have to know a little bit about the procedure before you can choose the right surgical pathology code. Okay? All right. So here, this one has a tumor and has a biopsy. Okay? So you're going to look under tonsil and the biopsy. Okay, so just go through this as an example, read it carefully. Okay? Some modifiers that you might use in this particular section, 90 if you send it to an outside lab, a repeat test. Okay? I want you to get to this point before we get any deeper in the woods. Here's some examples of abbreviations, because we do use a lot of abbreviations in healthcare. Okay, so that's kind of a summary of pathology and lab.